Hi, this is Jessica DaMassa, and welcome to this episode of Health in 2.00, where we ask Matthew Holt all your burning questions about health and technology in just 2 minutes, because, frankly, that's all we can stand of Matthew. So we're going to get started here, Matthew, and this is how it works. For those of you who haven't watched before, we have 2 minutes. We ask Matthew all of the questions that we can. When the buzzer goes off, if the question's already been asked or if Matthew's in midstream answer, he gets to finish. Any questions we don't get to, we either roll over to next week or we'll never know the answers. Matthew, are you ready?
Ready to be.
All right, and you're so lucky because of Valentine's Day, we have some love-themed questions for you this week. Ready? Here we go. Okay, so in some relationship news, we have Roche acquiring Flatiron. Is this a good change in relationship status or not?
Well, it's a fantastic change if you're Flatiron because they've had a little over $300 million, I think, went in so far. The valuation of 1.2. They got out at a valuation of 1.9, which is huge because I believe the company had less than 100 million in revenues, was the rumor I heard. I'm a bit worried about anybody doing a deal with a big drug company just because $2 billion isn't that much for a big drug company, and they may lose interest after a while, but hopefully it's good news all around.
Well, hopefully love is in the air for a long time to come. Where love is not in the air is at Nokia. It seems that they are breaking up with their digital health business. Is this a good big breakup or a bad breakup?
I think that they need to feel some more long-term love here. The bathroom is going to be a data hub for healthcare, for the next decade or so. And I'm quite surprised that after only being 18 months in the bathroom, they want to get out of it. So I'm surprised. I think if they hang on a bit longer, they'd do better. But if they want to leave the bathroom, sometimes you just got to get out. Maybe it's not too bad.
The FDA, so they've announced their budget for the upcoming year, and there's a lot of dollars earmarked for digital health and for this medical data center. Are we feeling the love, you think?
A lot of love from the FDA for people who are building the new type of medical devices, which includes the digital technology stuff, the diagnostics and the digital therapeutics. Scott Gottlieb, who's the new commissioner, one of the rare sensible appointments by the Trump administration, and Bakul Patel, who's running that division, have really shown the love to the sort of the Health 2.0 and health technology community. So I think there's a lot going on there, and they've made some very sensible moves about how to regulate, and how to lightly regulate this new area. So love that.
Yes, we love being wooed, don't we? All right, last question for you here. We have your health policy Valentine. So hashtag health policy Valentine. A lot of activity this week in honor of Valentine's Day.
Oh, let's go.
Got to answer.
Okay, I'll present the quill. All right.
So give us your favorite health policy Valentine. It can't be one of your own.
Can't be my own? Oh, even the one where I said that I wanted to give I told my wife for the health policy Valentine's that she told me for health policy Valentine's that I had to cut down on my practice variation. All right. That was mine. Okay, let me think. I think Andy Slavitt had a really good one. He said something on the lines of, he said, I thought that writing a health policy Valentine's would be easy. Then I found out there was a work requirement. It's kind of witty about Medicaid and his successor running CMS at Seema Verma at CMS. Sorry, his successor at CMS, Seema Verma is going to allow states to impose a work requirement.
I love that. They're
not
really
even the own state of Indiana. So,
well, if anybody wants to take a look at some other health policy Valentines, they're at hashtag health policy Valentines. Take a look. So, Matthew, that's all the time we have for today. For anybody who's interested in submitting questions to us, so you don't have to engage in a 45-minute long conversation with Matthew if you run into him. Well, it's a little bit faster to ask this way. So what you can do is you can send an email to me at jessica@jdminsights.com. Or you can email Matthew at
matthew@matthewholt.net.
Fantastic. Well, we look forward to seeing you next week. Thanks so much for joining us at Health in 2.00. Have a great week.